Unfortunately, groups like Native Americans are affected by socioeconomic disparities, and with limited access to health resources, I think is affecting their them to have more of the risk factors and even increased risk of stroke in these populations, which is why we need to be very wary of these groups, special groups. Based on our study and several other studies that were done prior, high blood pressures are actually extremely common in Native American population, especially in patients with ischemic strokes. In our study, we found out that there was more than 50%, more than half of these patients had high blood pressures. And high blood pressures can directly affect the blood vessels supplying the brain and can lead to strokes. And they not only affect the brain, but they can also affect the other organs like the heart and the kidneys. And from a treatment and management standpoint, we need to focus on exercise and salt-limited diet and ensuring that the patients actually follow up with primary care physicians to make sure that we take antihypertensive medications and be compliant on them, and appropriate follow-up is done to make sure that these numbers are within the target ranges. So starting off at the grassroots levels, the education regarding healthy life patterns like very good aerobic exercise and taking a high vegetable and fruit based diets and limiting salt intake as I mentioned before, and being compliant with the medications and following up with the primary care physicians. I believe all of this and the education regarding this would be very helpful in limiting or these risk factors and preventing strokes and other related complications going forward.